Good morning, good afternoon, and good evening, wherever you may be in this little planet. Welcome to the Nerve Conduction Study and Synkinetic Correlation Test webinar of Crystal Touch Clinic. My name is Alex Pashov. I'm the director of the clinic, and I want to welcome you again to this webinar. We will discuss the topic, which is very important for the patients, and the topic is Nerve Conduction Study and Synkinetic Correlation Tests. As you have seen in the advertising of this webinar, what you can measure, you can manage. So let's see how we can do that. Just a few words about the clinic. The clinic is located in Rotterdam, and we are specialized exclusively on rehabilitation programs for long-standing facial palsy. It could be Bell's palsy, it could be Ramsay-Hunt syndrome, it could be post-operational palsies and palsies from other causes, including bacterial infections and so on. We work with our patients with rehabilitation programs for residuals and complications. As you can read from the slide on the screen, we are members of the World Federation of Rehabilitation. We have had several presentations in the latest congresses of neurology and neurorehabilitation in Europe and the world congresses. And we also have a humanitarian project, which is called Bring Back Your Smile. And there are, of course, conditions for that project, and it's meant for the adults and children with very heavy, very easily visible residuals and complications of long-standing facial palsy. We conduct quite an extensive scientific work. We have been to the World Congress of Neurology in Dubai with our presentation in 2018, 17, 16, 15, and before. We have participated in several European and world congresses for rehabilitation, neurorehabilitation and neurology, with the presentations of our method, of presentation of our achievements, and presentations of our views on how residuals and complications of long-standing facial palsy should be and can be and should be treated and recovered. We are 4 specialists in our clinic, 2 ladies and 2 gentlemen, including myself. Although we are a small clinic, we have quite a large, extensive geography of our patients. We have literally patients from all continents and all corners of the world, from where patients travel to our clinic in Rotterdam for their rehabilitation programs. That was a short introduction. So let's carry on and start our work. As the name suggests, Nerve Conduction Study. We study how well the nerve, in that matter the facial nerve, is able to conduct the electric signals between the brain and the facial muscles. In our clinic, we have an equipment, therefore, it's this device made by a company called Neurosoft. And with this device, we are able to measure the recovery level of the facial nerve. Nerve conduction study for the skeletal muscle, for the muscles of the body, the muscles of locomotion, it's quite common modality when there are some doubts about whether the nerve or the muscles are not functioning properly, and it's quite widely used in neurological studies. However, the nerve conduction study for the facial nerve is not very widely used in most of the countries, at least what our experience tells us. It is very often used in the countries which used to be Soviet Union, Russia, Ukraine, Belarus, and so on and so on. It's sometimes used in Brazil, sometimes used in the Far East countries, but in the Western Europe and the States and the Canada, it's somehow not very often used. Most probably because Bell's palsy, for that matter, is not considered something that presents a grave danger to the health or life of the patient. It's indeed a damage to one single nerve of our body. And of course, this studies, it costs money, it's quite expensive. That's why I think that is the reason why nerve conduction study is not very widely used in most of the countries in the world. What we did, there is still a standard protocol of nerve conduction study. We have extended this protocol A usual standard protocol uses 3 or 4 points, or 3 or 4 muscles to measure. We have extended to 6 muscles: frontal muscle, orbicularis oculi muscle, nasalis and levator labii superioris, 2 zygomatic muscles, circular muscle of the mouth, and musculus mentalis and musculus depressor anguli oris. We have added locations to the standard protocol, and we have also amended somewhat the way we do the stimulation. Usually stimulation is done here, just behind and in front of the earlobe for all the muscles that are being measured. We have amended this, and we position our stimulating electrode to each and every branch of the facial nerve, so we get a very narrowly directed stimulation signal that leads to contraction of facial muscles. So what happens when we do a nerve conduction study? We put here an electrode, stimulating electrode, and we do a small electrical signal. It's 10 milliampere, 20 milliampere, and then 30 milliampere, just to see how the facial muscles, depending on which muscle we are stimulating, are reacting to that signal. So we assume that the facial muscles themselves are working properly. Then it's only the nerve that is damaged. So we can, depending on the signals, on the electrical response of the muscles to the stimulation, we can conclude how well or how poor the facial nerve has recovered. Let's take a quick look at some of the examples of normal nerve conduction study of a normal, healthy subject. As you can see, right side and left side are producing practically identical signals to a minimum stimulation of 10 milliampere. This is the circular muscle of the eye, musculus nasalis, the one that lifts the upper lip and wrinkles the nose. Musculus zygomatis, 2 of them, the minor and major. That's why you see this like a camel, 2 peaks. Musculus orbicularis oris, the circular muscle of the mouth, and musculus mentalis and depressor anguli oris, these 2 muscles here that are also producing practically identical signals. They are identical in the shape, in the amplitude, and in what is called latency. Is the peak, for example, of these muscles. That means how long time it takes for the electrical signal to reach the facial muscle from the point of stimulation. What happens when the facial nerve becomes damaged? Here you can see an example of a long-standing facial palsy of a female lady, 56 years old, 2 years since the onset. As you can see here, 1, 2, 3 is the affected side, it's the right hand side, and 5, 6, 7 is the left side. As you can see on the left side, it's frontal muscle, this one. The nerve is working perfectly. It produces maximum response to a minimum stimulation. And on the affected side, you see quite a modest response to the minimum stimulation, and to the higher levels of stimulation here, we see already larger signals, but they are different in the shape. They're different in amplitude than the healthy side. Very similar picture on the circular muscle of the eye. As you can see here, I don't have to explain much. Identical signals on the healthy side, and very modest responses on the affected side, which of course indicates that although 2 years has passed since the onset, the recovery level of the nerve can be and could be better. It does not mean that the nerve is dead, totally not, because if it were dead, then these signals would be flat regardless of the stimulation level. It's not dead, it's working, but not all of the fibers that have been damaged have regained their connection with their respective muscles. And of course, the quality of electrical insulation is much lower than it is on the healthy side. Let's take a closer look at the other 2 muscles, nasalis, the one that lifts the upper lip and wrinkles the nose. Very similar picture. And musculus zygomatis is the muscle that produces the smile. You can see here on the first part, they are fairly identical, provided the stimulation level is high. And on the second peak here, we can see that definitely we are lacking recovery on one of the muscles. It's the zygomatic major muscle. And two muscles remaining, orbicularis oris, that's the muscle, that circular muscle of the mouth. Also a very clear difference between the healthy and affected side, and also quite a noticeable difference between healthy and affected side on the musculus mentalis and depressor anguli oris, the muscle that stands us in the way for smiling. But still, as you can see, the recovery level of depressor anguli oris is quite high, and so the signal is big. So that muscle, even with a low level of recovery, is very much able and capable of resisting the smile. That's a short version of description of the nerve conduction study. And of course, in the course of our rehabilitation program, we monitor the changes in the condition of the nerve. We usually do the nerve conduction study during the very first visit of our patient to the clinic, and we do the second measurement after the completion of the first module of rehabilitation. This means after the fourth or during the fourth visit of the patient to the clinic, we do a control measurement to see how well the recovery has progressed. What I want to share with you now is the instrumental measurement method for the synkinesis. There are several methods to evaluate synkinesis. Most of them, they are questionnaires. So this question lists, how you feel this, how you feel that, and so on. It's being either assessed by the patient himself or herself or by the therapist. That then gives you a certain score depending on the visual observations of the patient or of the therapist, and gives you a certain score. And then in the course of rehabilitation, you observe changing of that score. There are also one or two methods of video evaluation of synkinesis, which means that you sit in front of the video and the video camera records the movements of your parts of your face and excursions, the movement of your healthy side and affected side, millimeter here and 2 millimeters there. So it measures actually the differences in the movements of your healthy side and affected side. And that way it measures synkinesis by visual observations. As far as I know, except for what we have developed in our clinic, it's called Synkinetic Correlation Test. No other instrumental tests are available to measure quantitatively synkinesis. As you can see on this slide, what we do when you do the synkinetic correlation test, we place two electrodes here on the frontal muscle and on the musculus orbicularis oculi, and two other electrodes here on the zygomatic muscles and the musculus mentalis and musculus depressor anguli oris, which means we are measuring the two areas which are the most involved in synkinetic patterns. Of course, we know that ocular oral synkinesis means that when the patient closes or blinks the eye, the mouth corner usually involuntarily moves. Sometimes the neck is also being involved and the chin area, or the other way around, when the patient smiles or puckers the lips or makes blows the cheeks, the eye involuntarily closes, so the eye fissure becomes more narrow. We have named the muscle that initiates the movement a master, and the muscles that follows the movement in synkinetic involvement slave, or you can call the driver and the follower. Here on the left side, when you see norm, when the person is blinking, these are the blink. This is what the electrical presentation of blinking, normal. You can see very little effort, and the eyelid goes up, down, and then back to its neutral position. In that case, the muscles around the mouth are not involved at all, so the signal remains unchanged. The same pattern we observe when the person makes a rhythmical smiling, light smile. As you can see, also very small efforts are necessary to produce a smile because there's nothing is resisting. And of course, the eye area remains totally nicely relaxed and uninvolved. If you look at the synkinetic pattern, we can see a totally different picture. First, when the person is blinking, rhythmical blinking here, we can see that it involves a lot of efforts by the eye, by the muscle, that circular muscle eye, before the eyelid closes. And of course, those efforts are spilling over to the other muscle, which means in this case is the muscles around the mouth. So we have synkinetic movement with a lot of efforts applied, both on the master side and on the follower side, slave side, so to say. There is a phenomenon which is called reciprocal inhibition, which means when the agonist muscle contracts, antagonist muscle relaxes, and it goes automatically. On the healthy side, as you can see, there is very little effort, physical effort is necessary to produce the facial movement. And on the synkinesis side, on the patient after facial palsy, a lot of efforts is being involved. It's not necessary so much efforts to move the eyelid. So why is that much effort is necessary? The answer is very clear, because something is resisting the movement. And what is that something? It is the muscle that is called levator palpebrae, and it is the muscle that is here. I put all the, that is located here, and it is lifting the eyelid. The tricky thing about this muscle is that it does not belong to the system of the facial nerve. It belongs to the other nerve, nervus oculomotoris. It's the nerve that moves the eyeballs. That is why it is, when a facial palsy strikes, it is very easy to open the eye, but practically impossible to close it. And of course, when the muscle remains contracted, for that matter, the muscle that opens the eyelid, for an extended period of time without stretching, it becomes stiff. And so the brain gets used to keeping this muscle contracted and would not let go it when it's time to close the eye or to blink, even after the connection between the circular muscle of the eye and the brain has been restored. It's the same like if I walk like this with my arm up for 3 days, and it will be very difficult for me to put the arm down, because the brain will get used to contract my deltoid muscle so much that it would not be able to relax it that easily. And that's why the muscle, the part of the circular muscle of the eye that closes the eyelid, needs to put a lot of efforts to overcome the resistance. I'm sure that those of you who have experienced synkinesis, especially ocular oral synkinesis, they know that feeling, when you have a feeling that you have to make an extra effort to close your eye. And as you make that effort, your mouth corner involuntarily moves outwards. It's called motor overflow. That's the real example, the patient on the healthy side and on the affected side. You can see very clearly that the healthy side is producing the same signals as we have seen on the previous slide. No efforts whatsoever, neutral expression, eyes closed, rhythmical blinking, and light smile, broad smile, nothing special. The eye area remains uninvolved, and totally different picture when the same person on the affected side, which you can see here, is doing an effort, making an effort to produce certain facial expressions. Totally different picture, because the brain is exercising a lot of efforts. It's not because the muscles are weak, it's the other way around. The muscles are putting too much effort, much more than necessary, to contract. That's why the excitation in the motor cortex, that is where these signals are produced, spreads out the adjacent areas and also engages the other muscles. For that matter, is the muscles around the mouth area. As you can see here very clearly, the pattern of contractions of the muscles around the mouth on the affected side when squeezing the eyes is totally different than the pattern on the affected, on the healthy side. Similar picture and similar correlation. That's why the method is called synkinetic correlation between the healthy and affected side, between the muscle master and master slave. It's a correlation. You can see here that when the person is smiling, a lot of resistance here, so the efforts are much higher than on the healthy side. Yeah. And of course, that's why, due to motor overflow, the excitation spreads out and involves muscles that are normally not involved in regular mimetic pattern. You can see here very clearly on this dynamic presentation, it's the same face, only the affected and healthy side are mirrored. So if this is the original affected side, this is the original healthy side. If we mirror the healthy side to the other side, we get this facial expression, just normal, that looks normal, the way that any regular healthy subject would produce. And if you look at the affected side mirrored to the healthy side, we see a totally different facial expression, and we can see that this expression involves a lot of efforts. And you can see that all the antagonists are working against each other. The person is trying to squeeze the eye, but the muscles frontalis and corrugator supercilii, they are contracted and they're pulling the eye up, and they are not letting the eyebrow go down. And when the muscles want to move the mouth corner in the same direction as on the healthy side, the antagonists are resisting very heavily, and that's why we have this very characteristic over tense expression of the face. Another dynamic presentation, this is the broad smile. If you can see, well, as you can see, it is the two halves of the face of the same person smiling. Only this is the healthy side mirrored, and this is the affected side mirrored. As you can see, the facial expression on the affected side is totally different, and it also involves a lot of extra efforts, especially in the area of the below the mouth corner, that actually resists the intended action. And during the long recovery period, especially after the reconnection has started to take place, we experience these contractions, involuntary contractions, and in the course of those many months, and for some of you years, this pattern, mimetic pattern, becomes a habit. It becomes a habit of the brain. And with a positive feedback from the contracting muscles, it becomes a conditioned reflex. So actually, from our point of view here in the clinic, facial synkinesis is not a result of aberrant regeneration of the facial nerve. We are back with the second part of our webinar, which is questions and answers. Radim from Czech Republic is asking, the measuring hardware and software which we are using is developed especially for your use, or is this a common used product? The hardware which we are using, it's produced by the company Neurosoft, and the separate modalities that are included in that hardware are pretty standard. As I mentioned in the beginning of this presentation, we have amended the standard protocol of a nerve conduction study. We have expanded it to be more detailed study, and the synkinetic correlation test we have developed ourselves. There is, of course, instrumental possibility for that included in the hardware, but the modality and the program and sequence of what we are doing is developed at our clinic, and it's, as far as I know, it's not done anywhere else. Wasma from Netherlands is asking how your technique help in treatment. Well, if you're asking about the measurements that we have discussed, Wasma, well, the idea behind the whole nerve conduction study and synkinetic correlation test is to make a snapshot to detect where we are standing in the beginning of our rehabilitation program, to see what are the points of extra attention, to see what needs to be corrected, and the most important, what we experience practically each and every time, to reassure the patient that his or her facial nerve is not dead, that it has recovered at least to a certain degree, and it's functioning and it is doing its job. This is very, very important. And of course, We have a different modality, which is called split, which is based on our second part of our test, which is Synkinetic Correlation Test. It uses this similar technology, similar software solution to help the patient to overcome synkinesis. We use this modality in the later stages of a rehabilitation program. So this modality is, we don't introduce it to our beginners. We only introduce it to the advanced patients who are pretty far in their rehabilitation program, because before that, it will, the skills that the patients have to learn before they can step over to the split modality are not yet there if you start it from the very beginning. Also, is the nerve conduction study test included in the clinic service when we see you for therapy? Thank you. As I mentioned, yes, we always do nerve conduction study and synkinetic correlation tests on the very first meeting that we have with our patient. Kerry from Australia is asking, are there any other machines in the world to measure synkinesis? I've answered this question already, but in theory, every standard machine that is used for nerve conduction study can, in theory, measure synkinesis, but of course you need software and the method to do that. Could one come to you for treatment of synkinesis, measurement of synkinesis, and then you instruct doctor in Sydney what to do? Well, I find it pretty challenging, because then we have to educate your doctor how to do our rehabilitation program, what to take into consideration, what to do, what not to do. So actually we have to train your doctor in doing what we're doing. And we have not yet composed our training program. We have that in our ideas, in our perspective, but because we are all the time, or most of the time, busy with our patients, we are short of time resource to make that training program a reality. So the answer to your question, Moira, is I don't think that will work. Do you have any other clinics around the world, and are there other machines of this sort around the world? If so, where? We do not have any branch offices in other parts of the world. That's why you have seen in the beginning of this presentation that the patients from all over the world, including Australia, by the way, from where you, Moira, are, from Sydney, are coming to Rotterdam for their rehabilitation programs. We do sometimes travel for our seminars and webinars, and we give, we travel for seminars and workshops, and we give webinars to help our patients to improve their knowledge and understanding of rehabilitation facial palsy. But we do not have clinics in the other parts of the world. And the machines asking about if there are any other machines in the other parts of the world. Yes, there are. There's only the question if those who possess their machines are trained in doing nerve conduction study of the facial nerve. And of course, synkinetic correlation test we do only in our clinic, because it does not exist in other parts of the world, as far as I know at this moment today. I hope I have answered all your questions, and I thank you very much for your time, for your attention. If you have further questions, please don't hesitate to write to us via our contact page. And I wish you to be in good health. I wish you to recover quickly, and I wish you to bring back your smiles. Thank you very much. Have a great day and a nice coming week. Goodbye.